Good evening. So welcome to yet another session, AMA session, which happens every Tuesday at 9 p.m. in Indian Standard Time. Okay, so shall we start? Okay, so the weekly sessions. So today we are going to talk on psoriasis management. If you note, psoriasis is something which is becoming pretty common nowadays. So when I would say, might be 25 years or 27 years, I've been practicing for close to about 28 years now. So in my early days, I never used to see so many cases. Even when I was sitting with my guru, we used to have a lot of cases, but psoriasis cases was not so much. Now, a lot of cases are coming up, psoriasis. So we start thinking, why so many cases of psoriasis. But if you look at the textbooks of Ayurveda, yes, this condition has been mentioned. So it's not something which is very new, but in my opinion, it's more prevalent than what it used to be before. Okay, and I think studies have said that it's more prevalent with people with white skin rather than people with black and brown skin. Okay, so let us get into psoriasis and its under management in Ayurveda. Okay, so yeah. So basically, psoriasis, it is the issue is on the skin. So it has been said as a skin disorder. It is pretty chronic, one or two patches here and there people ignore. They think it is something else. But when it becomes chronic, only we identify it as psoriasis. Okay, so it is chronic. It is non-infectious in the sense it does not spread from one person to other. Okay, it is an inflammatory condition. Okay, it sometimes you can feel it goes up and it goes down. If you look at the blood test also, you can see that the values of ESR and CRP also will go up when you have got psoriasis, when it's in the flare up. So it is basically inflammatory. You will see well defined. It's not. You will see it is slightly raised, and you will see a well-defined patch. Okay, as far as psoriasis goes, and you will see scales falling out of it. You see a lot of scaling, and it almost it's like silvery color. So this is basically how a psoriatic thing looks, and it has been considered to be an autoimmune condition. How do you understand what an autoimmune condition is? See, basically, when your autoimmune condition develops when you're at some given point of time, your immunity is compromised. In the sense you are actually going through something in life which stresses you so much and you suppress a lot of things, and suddenly what happens is a lot of things can flare up because your immunity gets affected. Okay, autoimmune condition is your body defenses actually is not fighting something something which has come from the outside. It is fighting its own body. So that's why it's called autoimmune condition, and this can be actually classified as an autoimmune condition. Okay, now in Ayurveda, how do you look at it? This can be correlated, okay, because when you look at the symptoms of kitibha, it can be correlated as kitibha. So when you have, so how do we understand this as vata pitta? That's if we understand this as vata pitta kapha, then only our treatment is something which we can do, because Every psoriasis, we don't have the same kind of treatment. It's not the same kind of medicine. It's not the same kind of protocol we follow for all kinds of psoriasis. Okay, so sometimes you look at modern medicine, you see that the treatment protocol for psoriasis is almost the same, but for us it is different for different conditions. How do you look at that? Okay, so when you have got more of flakiness, we consider that to be vata. When it is more of inflammation, then see, you will have flakiness, you will have inflammation, you will have itching, all those things are there. But when you have got more predominance, okay, that is where we have classified it as vata, pitta, and kapha. And as when even when you look at the body, anything above the chest is kapha. So when you have got more of flakiness in the upper part of the body, you have got more of issues in the scalp, ears, and all those things, then it is morely considered to be more of kapha. Okay, when it is in the trunk, then it is mostly considered as pitta, and when it is in the extremities, more as vata. Okay, and when it is associated with pain, it is vata. When it is associated with burning sensation, it is pitta. And when you have got oozing or itching and all those things, swelling and all those things, it is basically more of kapha. So this is how we understand how a psoriasis is, and then the management of this is depending upon these conditions. Okay, now there are also a lot of complications which can happen if you don't treat it really well. Okay, you can have, there's something called psoriatic heart. Okay, psoriatic arthritis is there, so you have got heart issues, you can have joint issues, you can have kidney issues, eyes, diabetes, blood pressure. Mental issues also happen, because when your skin, when people look at you and your skin is not well, you want to always cover it. You sometimes go into depression because you feel that your beauty or your skin is not good, that you can show it to people. Okay, so it can also lead to other autoimmune conditions also. Okay, so psoriasis is something which you have to handle it really well. Okay, then what? Management. How do we manage this? Okay, so if you look at Shodhana is one thing which is very, very important, because kitibha or psoriasis does not occur with very little doshas. It is chronic, as we said, it is chronic, and it's got a lot of doshas, that those doshas have to be removed. So cleansing the system is very important. Okay, so panchakarma depending upon the dosha. So when you have got kapha, that means when it's on the upper, when you've got too much of itching and swelling and oozing and all those things, vamana, or making the person vomit initially to remove the dosha, is very important. So vamana for kapha. Virechana is loose motions, inducing loose motions, and rakta moksha is removing blood when you have got too much of pitta involved. Okay, and if it is vata involved, we do virechana also, mild virechana, and vasti is done for, vasti is basically medicated enema when the condition is more of vata. Okay, and after the doshas have been removed. Okay, so but if the patient does not have the strength, then we don't do shodhana for him, we directly go for shamana. Shamana is basically pacifying it. So once you have removed, after shodhana, once you have removed all the doshas, it can never happen that all the doshas go out. So a lot of doshas go out, and the remaining doshas, what you do is, they are not strong enough to aggravate, so you pacify that and you control it. That is basically called shamana. And after shamana is done, after that only you go to the rasayana therapy. Every disease is basically the same. Rasayana therapy is done basically to strengthen the body. And why do you strengthen the body? You strengthen the body, your immunity goes up. And when the immunity goes up, there's something called apunarbhava. That means the disease does not reoccur. So if you don't do this, normally what people do is they cleanse and they leave the person. Shamana is very important. That means you pacify the remaining doshas. And that itself is not enough. You actually create strength for the body, nourish the body, do rasayana therapy to see that the body is strong enough, and it completely eradicates the condition from its root. There is no coming back. So rasayana therapy is very, very important. Okay. Now, food restrictions are very, very important in most skin diseases, especially in psoriasis. Okay, what you have to avoid? You have to avoid milk and milk products. All milk and milk products, especially curd, have to be avoided. but you can have ghee and buttermilk. And if that buttermilk is processed, you heat the buttermilk, add a little bit of turmeric, ginger, curry leaves, and all those things, then what happens? It becomes much better. Okay, black gram has to be completely avoided. Urad, we call that in Hindi, black urad in Malayalam. So anything which prepared out of that also has to be avoided, like idli, dosa, vada, and all those things have to be completely avoided. Jaggery is something which is not good for any skin condition, and especially for psoriasis. If you take more of jaggery, your kapha goes up. There's always a chance of oozing and itching. Okay, so jaggery is completely avoided. Non-vegetarian foods, fish, meat, including eggs and all those things, have to, anything that can increase protein is also not very good. Okay, so too much of protein also not good. So most of the pulses we ask them to avoid. Okay, you can start asking a questions. Don't worry at all. Okay, so most of the pulses we ask them to avoid. Moong or moong dal is supposed to be really good, so that person can have, or masoor dal, which is actually what you call orangish in color. Okay, that masoor dal is actually good. Apart from that, you can have millet, you can have rice, you can have wheat. All those things are fine, not a problem. These things, if you can avoid, it will actually help you recover faster. Okay, urad dal. The question I see that Divya, I'll come to that. Urad dal will not cause psoriasis, but after a point, it start triggering if you have got skin issues. Okay. Now, vegetables, as far as vegetables go, anything which is slightly bitter will help cleanse the blood better. So veggies which grow on the creepers, most of the gods, bitter god, snake god, bottle god, all the gods are pathya, are actually good in conditions of skin conditions, and especially in psoriasis. Okay, now let me get into the questions. Divya, why is urad dal a problem for skin disease in Ayurveda? Okay, urad dal or masha, we call it. Masha is guru. It is heavy. Okay, it is snigdha. It is slimy. And what happens with it? It is not very easy for it to digest. It actually goes into the system and blocks all the channels. Okay, so that is the reason why not only in skin issues, most of the issues. Okay, we are people are asked not to take too much of urad dal if possible. But if the person is emaciated, I'm telling you, conditions where the patient is extremely emaciated, yes, urad dal is good. You roast the urad dal, you make something out of it, but still you actually roast urad dal and you don't give it as such. Urad dal for people who don't consume meat. Okay, we tell urad is actually as good as meat. Okay, it is not easy to digest. So in skin conditions, even though it is predominantly pitta, it is tridoshik. Okay, and masha or urad dal is not good because it can increase the what you call sliminess of the body. And you can also do a test at home. Divya, you powder urad. Okay, you add a little bit of water into it and see how sticky it is. Okay, you can actually stick anything onto the wall with urad. It is so sticky. So avoid things which are extremely sticky when you've got skin issues. uh, Tarun, should we avoid sour and fermented foods like apple cider vinegar and kombucha or kimchi or fermented? Um, yes, as far as skin issues go, anything that can aggravate the pitta a little bit more than normal is not advised. Okay, so you have to cut down on spicy foods, which there are. See, if you look at what increases pitta, okay, sour, salt, and spicy foods increases pitta beyond a certain limit. So those three things have to be controlled or taken care of when you've got any skin issues. Okay, and especially fermented batters, anything which is ground and you make a batter out of it. According to Ayurveda, it is not for nitya seva, or not for consumption on a daily basis, even when the person is healthy. Okay, so when a person is unhealthy, it is not good. Fermented food is not good for regular consumption, according to Ayurveda. Okay. Is it correct to say that most of diseases have their origin or some connection? Um, Spiky pine. It Most of the diseases. It's not that all diseases, but most of the diseases. That is the reason why a disease has got a synonym called amaya. Amaya means from ama. Ama is basically undigested residue of food because of improper digestion. So most of the diseases actually originated from improper digestion. And when you look at skin issues, okay, skin issues, when we look at the causative factors, the first line itself is it starts, Mithyahara viharena visheshena virodhina. Mithya means wrong. Ahara vihara, wrong food and activities. In the sense, you take a shower immediately after food. Okay, you apply oil after shower. You do massage. You do massage immediately after having food. So that is mithya vihara. Mithya ahara is wrong kinds of food. Mithya ahara viharena visheshena virodhina, specifically viruddhahara. That is one major reason for all skin issues. Okay, if you ask for specific skin issues, yes, wrong food and wrong routine is one major reason for skin issues. But other issues also, yes, definitely gut plays a very, very, very important factor. I think your question, Tarun, I think you should avoid sour and fermented foods for all kinds of skin issues. And, even though see these things, apple cider vinegar and fermented foods like kombucha and all those things, in my opinion, okay, I wouldn't recommend that to be consumed on a daily basis. You can have it if you want to, but have a little bit. Have it probably immediately after food, just immediately after food, so that it doesn't become very strong on the body. So it's the only fermented food probably Ayurveda says that you can consume is buttermilk or takra. Okay, it is light to digest and it is not cold. When people think that buttermilk is cold, that's why they can drink in summers. No. Okay, you can have it in summers because it is legu and it opens up all the channels if it has been prepared really well. Okay, so takra or buttermilk is the only fermented food that basically can be consumed on a daily basis. Other things, Ayurveda does not basically tell you to have it on a regular basis. Ravina, will rabies vaccine cause psoriasis in kids? Um, See, conditions where anything, it can be anything. Uh, First of all, genetically, if you have got a genetical disposing factor, then you can get anything that can suppress your immunity can be presented in many, many ways. Okay, rheumatoid arthritis also, RA we call it. Rheumatoid arthritis is also an autoimmune condition. Okay, so for that also, anything can actually trigger it. So sometimes, but very rarely, see that rabies vaccination can cause psoriasis, because kids also take rabies vaccination, but I don't think it can be directly called. But anything that can suppress the immunity has got a chance of causing psoriasis. If you look at that from that angle, rabies also can cause. Okay, because it is basically getting in. Any vaccination is actually directly related to immunity, right? So you can get it, but that is not a major thing. Divya, yes, your traditional recipes include a lot of jaggery. Yes, payasam, as I said, all those things, as I said, I have told you to avoid jaggery when you have got a skin issue. Consuming jaggery will not lead to skin issue. Don't get confused between the both. Okay. Pretty so, but when you get a skin issue, then I would say you should actually go down or avoid jaggery. Consuming jaggery will not lead to skin issues. Don't get confused. Okay. Once you get a skin issues, all these things are triggering factors. I would say remove the triggering factors. Direct jaggery or having, once in a while having urad dal and all those things will not lead to skin issues. But if you have got a skin issues, be careful. Okay. Nail psoriasis. Okay. If you look at nails, okay, naka, danta, and all those things are basically mala of vata. Okay, hair, bones, and nails are the mala of vata. So and as I said, it's in the extremities, right? So there is a very, very, very high possibility that it is more of vata. Okay, her age, if you say that she's 10 years old, if she's 10 years old, that means her age is kapha age, but she's suffering in her extremities, then it could be a vata, what do you call, psoriatic condition in the kapha age. And it need not be very, very, very severe. The skin, the nails and all those things might get disfigured. It'll get okay, then it'll come back, it'll get okay, it'll come back. That might be the condition, because the age of the child is kapha age. Okay, next stage after the child becomes 14 or 15, probably you can see that as if you are giving any immunosuppressants, then it might not be very easy to handle it. I would say that you should let the body initially might find a little bit different, but I would want the body to actually take over the condition rather than see here. See, if you look at it, it's an autoimmune condition. That means, as I said, the immunity has been compromised. So if you still give medicines which will suppress the immunity, when will the immunity come up and take over? It's a thing which you have to think of. Okay. So right now, because it's only nails, it is by the sthana and all those things, it is vata. The child is in kapha. That's why it's not so. It need not be very severe. Tarun, raw foods like salads, if you look at Ayurveda is not it's not something which is very fond of raw food. Fruits, yes, it does not tell you too much, because it's not pretty difficult to digest. But otherwise, most of the vegetables and things and all those things have been advised to cook and have. Okay. The theory behind this is, like any indigestion happening can lead to any issue. As you said, most of the issues start from what you put inside your mouth. So to avoid that, if you cook something, that's the reason why, you would have seen parboiled rice and raw rice. Parboiled rice is easier to digest when compared to raw rice, because same thing with if you take a salad, fresh salad, and the same salad you actually steam cook it, the steamed cooked one will digest faster than its raw variant. Okay, so if you cook something, it becomes lighter, because once cooked, cooking happens here also, right? So once cooked, it is easily digestible. So that's one reason why Ayurveda focuses more on cooked foods. Okay, so it is not only skin issues, but otherwise it's always good to have food which is cooked. And salads, especially, when you start eating lettuce and leaves and all those things, it is not very, very safe. I would say you should actually wash it really well with turmeric water, and also steam cook it with a little bit of turmeric. There might be spores, a lot of things which actually are stuck onto the leaves, which you cannot see through naked eye. So for all those things to be removed from the salads, in my opinion, always steam cook and have it. Okay. If you're really hungry and you want to have, you have eat a salad, probably your body, your agni might be able to nullify all those pores. But if you're having it, sometimes what people have is they have it along with cooked food. That might be a problem sometimes. Okay, so when you're eating uncooked food and cooked food, don't mix those. If you're having salad, eat a little bit of salad, no issues at all. But in my opinion, it's always better to have it cooked. Okay. So any other question? So psoriasis is something. So we also do. So when we do treatments, some patches. Mostly you see, below the elbow or just below the knees, which might be very, very strong rooted patches, and that is where other patches, once we do the treatment, you will see that all other patches actually become light and they vanish. Some patches might be very stubborn and so they won't go. So that is where we do sometimes we feel, okay, there is too much of doshas over there. It could be the legs or it could be the hand, that it might be vatasthana, but even then, we do rakta moksha. Okay, we remove blood. So when it is a patch like that, we normally put 2 or 3 leeches around it and it sucks the blood from there. The moment, see what happens is when it is chronic, it becomes so hard that blood supply fails to actually reach that area. The moment you apply leech and things are sucked from that area, you'll see that there is a sudden rush in blood supply. That area becomes softer, right? There is a rush in blood supply and you will see the healing happens fast. The patches become smaller. Then after a couple of months, you again apply leech. Patches become smaller. Again apply leech. The patches become smaller. So these are the ways in which we manage patches which are extremely stubborn also. Okay. Yeah, I'm using Ayurvedic medicines. Yep. Okay. Please continue the medicines, and if you're feeling good results, very good. And I would say, just like I was telling about the do's and don'ts, the patthya and all those things. See that the child, as a child, 10-year-old, it's not very easy for you to tell what to eat, what not to eat. But as much as possible, if you can cut down on sweetened foods for her, like ice creams, chocolates, sweets, and all those things, it will be really good. Okay, and see that she is physically active so that she doesn't get indigestion. Okay, continue the medicine. I think she should be fine. Okay. Yes. Flaky psoriasis, on the scalp. Definitely, Tarun, there are medicines. I can just tell you right away, Yes, Sora oil. Yep, the Nagarjuna, a company called Nagarjuna. I can just type it out for you. Okay. There you go. Okay. You said Sora oil. It is the oil is Soria oil from Nagarjuna. The difference between this oil and other oil is that you have to apply this oil, wait for about half an hour, 45 minutes, and wash it. Okay, I don't want you to shampoo it really too much. One other thing is that you can also take 1 teaspoon of this oil in warm water twice daily internally too. Okay, that will actually make it work better. That's the reason why I say Soria oil. I don't know whether it is Sora oil. You mistyped it, but the name of the oil is Soria oil from Nagarjuna. It can also be taken internally. Take 5 ml with warm water, take it twice daily, apply this oil, leave for about half an hour, 45 minutes, and then wash it. Okay, it works really well. But still, I would say it's always good for you to consult a doctor and see how are other things, okay, so that you actually do the right treatment. Probably you'll have to also take a little bit of medicines internally, like some kadas, some kashayam and all those things, and even do a little bit of purgation also and remove all those doshas so that it is taken care of in the beginning itself. Okay, because sometimes what happens with okay, Tarun. Okay, so what happens with psoriasis is you sometimes feel that it has actually gone down, but again it comes back. But one, if you do the rasayana therapy really well, you see, we handle a lot of cases nowadays, and we see that the results are very, very, very encouraging. That once a person comes to us and psoriasis is almost gone, 5 years, 10 years without any issues, no medicines at all. But we always tell them, stress is might be something, and see, if there is something which has happened to you, it is like, it's like a trauma for the body, and it's the same thing happens. It is very easy for you to get either this problem or some other problem. It can be some other autoimmune condition also. So be careful. You should know that you have to take care of your body really well, your mental health. So you have to work, and this, in my opinion, is really well handled in Ayurveda. Okay. See, Malati, suggest a diet plan. Yeah. mm, if basically looking for skin issues, okay, as I was telling, the things which you have to avoid. And rice is okay, okay. Wheat is okay. Millets are all okay. And I would say you can have your pulses, but stick to more of moong and moong dal, okay, and cut down on spicy, sour, and salty foods. Uh, you can have most of the vegetables which grow on creepers. So that is absolutely no issues. You really have really good choice. People who come to us, and sometimes people who get admitted in the hospital also, they don't miss the food, because most they're very specific things which you have to avoid. Apart from that, all other things you can have. So it is not that they are deprived of a lot of things. So when we say you can't eat dosa or idli in the morning, whatever you make then and there is fine. You can have paratha, you can have roti, you can have upma, you can have poha, you can have idiyappam, you can have put lot of things which whatever you prepare then and there, you can have pesarattu here Telugu. Whatever you prepare in that, cut down on the amount of food you eat, and see that you also do a lot of exercises. So it's not a, it's basically you feel, oh, it's a torture. It's not a torture. You have got good varieties to eat, but nothing sweetened, nothing, no deep fry. See that you lose a little bit of weight also. And you also have to cut down on the stress. If your work is giving you too much of stress, but you still want to go through that stress and want to get relief from psoriasis, it might not be very easy. You have to take a call. Okay. uh, Spinach with paneer. See, paneer itself, in my opinion, okay, it's not something which you should be consuming on a daily basis. It's very, very, very difficult for it to digest. And I see a lot of videos which say that nowadays what the paneer you get in the market also is not good. Okay. So, you know, if you look at paneer, paneer is basically milk which is forced to get spoiled, or normally if it gets spoiled, or you spoil it by squeezing a little bit of lime, whatever you squeeze and take it out, that is basically paneer. You don't see paneer in any Ayurvedic test. I don't know whether, see, definitely in those days also milk would have gotten spoiled, but I don't think they used to actually take that paneer out, because milk is spoiled. They feel that it might not be good. So paneer, in my opinion, I don't consider it to be healthy at all. First part. Now having it along with palak, it tastes actually good. Even I consume it. It's not that I don't eat it, but I make it a point that these things, apart from the traditional foods, I don't get into most of the foods on a regular basis. Once in a while we go out, might be once in a month or once in 2 months, probably a paneer butter masala or a palak paneer or something we have. But apart from that, I would say these things are not good to be consumed on a regular basis. Shetty, I understand. pumpkin seeds, flax seeds, chia seeds, lot of these seeds are there in the market. Okay, and we see a lot of reels also, and they say about the oils which come out of it, the protein, and then a lot of nutritional facts about it. I am not an expert in it. Okay, and the last part of it, that flaxseed have to be consumed within 5 minutes of powder, is something which I am not very sure of, Shetty. I'm extremely sorry about that. Probably I can look into that and get back to you. Okay, even if I look into it, I'll be looking at Google to find out but I don't know whether that information might be right or wrong. But when somebody says, have A, B, C, apple, beetroot, carrot juice every day, those things I don't agree to. That everybody can have this and be healthy. No, it's not like that. Depending upon where you are, what you're genetically used to, food will change definitely. Okay, and eat whatever you eat in moderation. Eat what you're traditionally used to, what probably you are genetically used to eat those foods. Exercise moderately and sleep really well. Okay, you will see a lot of things on social media. I don't want you to really get confused about a lot of things. Our elders, our great grandfathers, they never had any of those things, and they were pretty healthy, in my opinion. Okay, so just follow this. Life is simple. Oro NK. Is Nitya Virachanam ideal in psoriasis with Gandharva Hastadi Airanda Thailam? Okay, Gandharva Hastadi Airanda Thailam is a preparation where it's a medicated oil, but the base is castor oil. Airanda Thailam means castor oil. Okay. See, Gandharva Hastadi castor oil is actually, it basically helps you pass motions. If you are also looking at okay, I'm not getting into treatment here, but for your information, or if you are also looking at the what do you call, property of the castor oil which can act on skin, okay, then Gandharva Hastadi castor oil might not be the right choice. If you want a castor oil base which works on the skin, then there is another thing called Nimba Amrutadi Eranda Thailam. Okay, Nimba Amrutadi Eranda Thailam, which actually works on the skin much better than Gandharva Hastadi Thailam, and you will get loose motions on a daily basis. Okay, but still, whether you need that or not is something again which you have to ask yourself. But normally, as I said, Rasayana therapy is actually good for all skin issues, especially psoriasis. Our choice as Rasayana, and there is something called Mani Bhadra Gudam or Mani Bhadra Lehyam, which when taken at bedtime will also give you soft bowels in the morning, and that is specific for skin issues. Okay, and the way you look at it, yes, it is very good for somebody to do a Nitya Virachanam is daily cleansing. Okay, daily cleansing is actually good for skin issues. Okay, what does that mean? When that you have to clean your system every day means that you should not dump anything unnecessarily inside your system. Okay, just because you are doing that cleansing doesn't mean that you can eat. So you stay with that pathyam, okay, that restrictions, and then you keep on cleansing your body on a daily basis. What happens? The amount of dosha in your body keeps on coming down little by little. But if you're looking at Virechana, Pakshat Virachanam, you have to do Virachanam once in 15 days. That means really good Virachanam once in 15 days. Okay. How to, yeah, my consultation. See, if you see me on Instagram, if you go to my profile, you can get a click. You got a link which will come to a consultation page. Okay, you can fix up your convenience slot. So I am available online for consultations. Yeah, I keep it very simple. I do a WhatsApp video call. Okay, and I make notes, and then your prescription comes to your email ID. So it's not very difficult to reach out to me. Okay. Mona, IBS. Yes, Mona, IBS is something which can definitely be managed. It all depends upon how chronic it is. Okay, and what is actually causing your IBS? There is also a mental issue attached to it. Okay, stress is something that's also attached to it. You have to understand, first of all, see, even before you consult a doctor for IBS, I'm telling you, do this homework. Before you consult a doctor for IBS, you should basically be able to understand what all situations, in what all conditions am I getting this flare up. Okay, if you know that, then it's easier for the doctor to basically handle it. Okay, so that is your homework. But there are a lot of factors, it can also be because of an infection in the tummy, which is easier to handle. Okay, or there might be certain foods which are actually causing that. That is also possible. And other things, medicines, there might be some stubborn infections, I would say, organisms which will not leave your tummy. And that also, with medicines, we can clean all those things. Another thing is that if it is stress, then that's also something which you have to understand, talk, and then resolve that. IBS is manageable. Okay. So I think we have come to the end of the session. Any other questions? Okay. So psoriasis, yes, I see that a lot of people have got, friends have got, we get a lot of psoriasis cases, and we see Ayurveda can actually handle it really well. Okay. Most of the autoimmune conditions like rheumatoid arthritis and that and this, we handle it really well. No issues at all. Okay. So if there aren't any more questions, probably we'll meet next week with some other topic. Okay, till then, bye-bye.